Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. Thank you for following our channel. And to remind you, I'm a cosmetic facial surgeon in Richmond, Virginia, and I do cosmetic facial surgery from here to here, and I don't do boobs, bellies, and butts. So at the end of December recently, I looked at our figures for the year, and I found out that I have, in my career, done over 5,000 eyelids. And I was very happy to see that. That's quite a milestone, and a lot of people don't do that in their entire career. And eyelid surgery is one of my favorite surgeries because it really can make people look younger, give them more self-confidence. And the upper face ages faster than the lower face, so it's not uncommon that we are seeing these patients in their fourth decade all the way on up. I've done them on people well into their 80s. So there are a lot of different ways to do this, and you've got to make sure that the patient is safe and they have a natural result. And you're gonna hear me say that a lot of times in this upcoming consultation video. So again, so honored that I've seen so many great patients from all over the world and all over the United States that have come here for eyelid surgery. And so what I thought I would do is walk you through an eyelid consult. And I went in today and I had a really bubbly patient. I've never met him before. And I just said, you know, I think this guy would be a good patient to talk about eyelid surgery. It really doesn't matter if it's a male or female. I mean, the surgery is a little bit different how you do it because you don't want to feminize a male. But this happens to be a male, and we do males and females, obviously. You know, cosmetic surgery is about 80% female. So what we're going to do is let you see this evaluation, and then we'll maybe walk you through some post-operative cases and then show you some actual before and after eyelid cases. Thank you so much for joining us. So here we are today with Mike, and we're going to do a blepharoplasty consult. And Mike has just come in, and if you look at him, he's in great shape. He's an active guy. He's an outdoorsman. And Mike, what is it, you can tell the camera, what bothers you about your eyes that brought you here today?
Well, sure. I'm very blessed to be in very good health for an old guy. I turned 60 in a couple of months, but definitely seeing the effects of aging, particularly around my eyes. So interested to speak with Dr. Niamtu this morning and see how we might address that.
Very good. And you know, the upper face ages faster than the lower face, so it's not unusual that we have people in here really even in their 40s to address eyelids. So what we're going to do is we're going to move the camera and we're going to zoom in here and show you how we do our consultation. Okay, Mike, so let's take a look at your upper lid. You look in that mirror, all right? So when I pull this up, you can see that you have all this extra skin.
Yes.
That really, when you take this off, it's actually going to probably improve your vision. Our goal is to get your eyelid more like that, okay? And we don't want it too high because that feminizes, but we just want to show more lid skin like that. You know, one of the things that we always have to talk about with eyelid surgery, just relax your brow, look in your mirror though, is brow lift. And you know, most guys don't do brow lifts, and I think that just taking this off is going to do what you want. And there's some skin and muscle and fat there that will reduce. I use lasers, so there's just no bleeding, and so we'll make a small incision there, and you won't see it with your eyes open, okay? On your lowers, now if you take this up a little bit, you can see this bulging. So these three bulges are fat in your lower lids. And I do my lower lid surgery on the inside, so there's no visible scar. That's called a transconjunctival approach, and I use the laser. And again, when you have no bleeding because of the laser, you have fast recovery, less bruising, less discomfort. Now, one thing you have, and this is really important, and if you went to another doctor to talk about your eyelids and they didn't mention this in the first paragraph, then you don't go there. But you have a little bit of lower lid laxity. When I pull this down, it doesn't go up all the way until you blink, okay?
I see that.
And also, I'm pulling it out more than 7 or 8 millimeters, and if I pull it down here, it's just not going back quick enough. So we're going to do what's called a canthopexy and do a little tightening procedure on the corner of your eye so that doesn't pull down.
Okay.
Now, a lot of people will cut skin off of the lower lid to treat it. And I don't do that for two reasons. Number one, when you make an incision here and go through the eyelid that way, you have more of a possibility of pulling this down. Number two, and the real reason, is because when you cut skin off, you're just stretching the old skin. You're helping the wrinkles, but you're just taking old skin and stretching it. I'm going to laser this skin with a CO2 laser. I'm going to make an intentional controlled burn, and that's going to burn off the discoloration. It's going to burn down the outer layers of skin where your wrinkles are, and it's going to heal back with new skin, new, lighter, tighter, brighter skin. That increases the recovery a little bit. You're going to have a burn here for about a week, and then it's going to be pink for a while, but you'll be happy that we did it, okay? So that's kind of what that entails. All right, Mike, so here's the situation. You're a great candidate for upper laser-assisted blepharoplasty, lower laser-assisted transconjunctival blepharoplasty, and lower lid CO2 laser. We kind of discussed the brow lift even before the video, and I just don't think that that's something that you want or necessarily need. So a couple big things. Your health history, you're in good health, no medical problems?
Correct, yes.
Okay. It is absolutely imperative that you have nothing that changes your bleeding status before your surgery, okay? Aspirin, fish oil, a lot, garlic, ginseng, ginkgo, we'll have a list for you, okay?
I understand.
And if you bleed behind your eye, bad things can happen, okay? So that's one of the most important things. Secondary to things that might change your platelet and your bleeding is activity. Okay, now you're an active guy, you're gonna want, the problem with guys is that they're like, well, I'm gonna have a week off, so I think I'll sheetrock my garage or practice my golf swing. Can't do that. I need you to be a couch potato, okay? So for a week, I really need you to just take it easy, and after a week, you can pretty much do what you want, all right? I mean, you'll be on your computer the next day. The biggest thing is gonna be that laser, where that burn is. That kind of looks a little funky because it's burnt, but when that heals, your skin's gonna look so much better, okay? And the actual surgery, we're going to do this with IV sedation. So you'll come in that morning and you'll meet my anesthesia provider and change it into a little gown. We'll go into the operating room, put an IV in and put you to sleep. And the actual surgery takes less than an hour, okay? And then we'll wake you up, take you to the recovery room. You're going to have a little plastic ice pack on, and you'll stay around here for probably a half hour, and then you go home and just take it easy for me, okay? There's not much you have to do. You're going to keep some Vaseline type product on your lower lid, and you can take a shower next morning and just you can walk around your house. I don't want you to do any bending, lifting, coughing, anything that's going to increase your blood pressure to make it bloody. We're available 24/7, okay? And of course, you already have my cell phone number. So the two things that we have to do, okay, are number one, patient safety, and that's what we're all about. We have a fully accredited surgery center, full-time anesthesia staff. I've done over 5,000 eyelids. It's one of my favorite procedures, and I have the greatest staff in the world. Okay, so patient safety. The other thing is a natural outcome. You have to look good for me to look good, okay?
Yes.
And it's your face, it's my reputation. So I wish we were doing it right now, bro. I love doing this. I get excited just talking about it. We'll give you a prescription for pain medicine, which a lot of people don't even take, and probably an antibiotic. And do you have any other questions for me?
Oh, it's been very informative. Thank you so much.
Well, I appreciate it, man. Good meeting you, Mike, and
Great meeting you.
I look forward to doing your surgery. I am so lucky that I get to do this for a living, and I really, I can't wait to come to work and do this kind of stuff. And when you have great patients and you get to do fun surgery, it's not even a job. I'm Dr. Joe Niamtu, lovethatface.com. So I'm going to show you a number of cases, probably more than you care to see, so you can look at the whole thing. There's probably 20 or 30 cases here, or you can fast forward if you wish. But what's important is this. Some doctors only show their absolute best results, and I've done over 5,000 eyelid cases. I have thousands of before and after pictures, but what I've tried to do here is to show you really great results and average results, because that's what nature is. That's what we are as humans. Some people that have extra skin, extra muscle, extra fat, and they have a lot of it, they're going to have a very dramatic before and after picture. However, other people just have moderate amounts of excess, and they're going to have a more moderate procedure. So I didn't want to show you only the oohs and ahs, which there are a lot of them on here, but I wanted to show you some of the what I consider garden variety blepharoplasty cases. And this is what you see in life, this is what you see in patients, and this is what you see in my practice. So I think if you look at these cases, you will find your own eyelids in there. If you're considering eyelid surgery, you'll see somebody and say, oh yeah, that's exactly what I have. I also think that if you look through this rest of this video, you'll have a better understanding for exactly what cosmetic blepharoplasty does. So sit back and enjoy. This is a female in her mid-50s, and she has excess upper eyelid skin. If you look, the top picture is the before picture. And our goal, she can't put makeup on because that skin touches her lashes. So our goal on the upper lids is to recreate that youthful space between the lashes and the orbital skin on the top. On the bottom, she has protruding fat bags and crinkly skin, and our goal was to reduce those fat bags and improve her skin texture, which we did with the laser. This is the same patient. The left is the before, the right is the after. Another view of the same patient, before and after. Okay, so we're looking at this male patient, and you can see on his right eyelid he has extremely excessive skin that hangs down and really blocks his vision. This patient just doesn't realize how dark it is, or how much of his vision may be obstructed just because of this heavy skin, and it also feels heavy. So after his surgery, we've opened this up and we have this nice shelf, and we've removed all this skin, and he can see better. His world is lighter as well. And same thing here. So when we have these shelves on a female, we want them taller, but on a male, we don't want to feminize them, and we want them much smaller. So again, you can see all this extra skin, and then you can see this nice thin shelf that this patient has after surgery. You can also see that his lower eyelid bags are. This is the same patient, other side. We've removed all of this, and it just makes this look more youthful when you see this shelf. And again, we've cleaned up this skin. Here's a patient who has permanent makeup, so it makes it a little hard to see exactly what's going on, but she has, again, extra skin here and on the uppers, and you can see that we've removed that extra skin, and now we can see back onto her eyelid and her shelf, and that is important for females. And you can see this patient just looks a lot older. When you open this up, it looks better, and we're going to try and remove that permanent makeup with laser. But same situation here. The patient just could not wear any eyeshadow or anything because her shelf is completely covered, and now we have this nice shelf. If the patient can apply eyeshadow if she wishes. Here's another case, patient with pretty blue eyes. We didn't really talk much about the brows. So males, we don't really do a lot of brow lifts on males, but on females, if they have low brows, we always give them the option. And this is not a brow lift video, and I can show you patients later who had brow lifts and blepharoplasty. So these are people that did not want a brow lift, just wanted their eyelids done. And again, this is the before, this is the after. You can see how we've opened up and rejuvenated those eyelids. This is the same patient, and their skin was touching her lashes. Now she has a crease there, a more youthful crease. We also got rid of these bags and tightened up that with the laser on both sides. And she's still a little bit pink from the laser, but she's covering that with makeup. But again, that's before, that's after. That's before, you can see the fat bags, that's after. This is the same patient after surgery, and this patient just looks old and tired, and by removing this skin, now we have a nice crisp shelf that the patient can wear makeup if they wish. Same thing over here. Here's a patient in her 70s. I think she's about 76, And again, aging upper eyelids, her skin hangs down below her lashes. Her brows really aren't in bad position, but we have this extra eyelid skin that's also crinkly. Really big fat bags on the bottom, and sometimes this is heredity with protruding fat and crinkly skin. On our after picture, we've opened this up into a much lighter, much more youthful upper lid. And I think you can see the difference, obviously, on the lower lids where we got rid of these fat bags and lasered the skin. So this is a great case because this shows how you can make somebody just look decades younger. This is the same patient before and after. Look at the upper excess skin, look at the nice shelf, look at the fat bag and the crinkly skin. That's the post-op. And this just about tells it all. I mean, this looks like her older sister and this looks like her younger sister. We've removed this extra skin and we have this nice shelf. The patient can put makeup on if they want. We've gotten rid of this fat bag and lasered the skin and smoothed it. So again, we've taken. When you ask a patient to look upward, that accentuates their lower fat pads, and you can see all this fat that the patient had. And you can see now, post-operatively, when she looks up, she does not have that type of fat. When you look at so many of these cases, after a while, they almost start to look like the same patient, but these are all different patients. So this is a very typical before picture with facial aging. You see the extra skin sits on top of the lashes, and you have all this extra skin. There's no definition. You can't see the eyelid shelf. On the lower lid, you have this protruding fat pad with crinkly skin. And here is a blepharoplasty procedure that I did. All these cases were done by me, obviously. And this is the after picture where you can see a more defined eyelid, more youthful lid with a discernible shelf. On the lower, we got rid of that fat bag and laser resurfacing tightened that skin. Here are some other selected cases. Here is a before and an after, and this is on a 67-year-old patient, so the patient is older. That's the other eye, same thing, before and after, so the rejuvenation is obvious. Here's a male patient, before, after, before, after. Here's a female patient, again, and this patient's only in her I think she's about 47, but still had this extra eyelid skin and some dark skin, some freckles, and some crinkly skin. So that's before and that's after. You can see how nicely we've rejuvenated those lids, opened that up. It just looks like a totally different patient in the before and after. And here is the same patient, again, before, after, before, after. Another view. So sometimes these look like totally different patients, and that's the goal of cosmetic surgery, to make you look different but natural. Cosmetic surgery should whisper and not scream. Same patient, looks so much younger just by doing this procedure that takes less than an hour in about a week or so of healing. And if we look at this little motion thing, you can see this patient before and after blepharoplasty. So again, these patients love to come back with makeup because they haven't been able to wear it for so long. So here's another motion graphic that shows the difference before surgery. And again, we have this extra skin. We have our upper lid skin touching the lashes. There's no crease that's visible, and this patient is not able to wear makeup. And we can see after surgery, we've removed this extra skin. We have a very crisp shelf, a nice crease, which in females is about 10 to 12 millimeters. In males, it's a little smaller. Same with Asians. Same patient before and after upper and lower eyelid surgery as I've described. Again, a motion graphic showing a patient before and after. And again, these patients have not been able to wear makeup, so we've taken some skin, muscle, and fat from the upper. From the inside incision, the transconjunctival, we've taken fat out of the lower, and we've done laser resurfacing, and that is my typical eyelid rejuvenation. And these are just other cases. This is upper and lower blepharoplasty. And what we're doing is we're looking at the extra skin, muscle, and fat that we've removed. And not all of these patients come back with makeup. And I try and take my before and after pictures without makeup, but some patients come back on their way to work or whatever. So you can definitely see the difference between the upper and lower lid. Another case, again, and when I look at these, I just really get excited because these are all happy stories where patients just were feeling old and tired, and we've taken some skin and muscle and fat away and done some laser resurfacing, and I think we've really changed their life, and that's why I enjoy this surgery so much. Here's a patient who had festoons, and again, upper and lower eyelid surgery and CO2 laser resurfacing. Another patient, you can see the power of lasering along with eyelid surgery. And again, some of these cases are very simple, but they are dramatic. So here's another case, and this is a little bit older patient who had a lot of redundant tissue, and I think we took decades of aging off her face by doing her upper and lower eyelids. This is the same patient. The after picture is a little blurry. I apologize for that. But nonetheless, you can see what a huge difference this made in this patient's rejuvenation. Here's a patient in their mid-50s, and again, heavy, droopy upper eyelid skin and fat bags and wrinkled skin on the lower lids. This is before and after. Same patient from the side, and you can see we've opened up that shelf. That patient had their skin touching their lashes in the before picture on the left. In the after picture, now we have a more youthful eyelid shelf, and the patient can put eyeshadow or whatever they want on there now and be able to see it. And again, this is one more picture of that same patient. And males, again, a little bit different. We are not trying to make a big shelf. We're just getting rid of some of the skin and doing upper and lower eyelid surgery. You can see the difference, and it's always a smaller shelf and a lower crease on males. Here's a patient with really significant fat herniation, and when they look up at the ceiling, that is a view that we commonly do that accentuates the fat, so you can see the difference in the before and after pictures. And again, this is my same approach: upper eyelid skin, muscle, and fat; lower eyelid transconjunctival, or the internal approach with CO2 laser skin resurfacing. And I have thousands of before and after pictures on my website, which is lovethatface.com. So males are less dramatic. However, they are in and of themselves dramatic because it makes people look younger and more alert. I have a passion for academics and education, and I teach a cosmetic surgery course at least once a year, and we have doctors from all over the United States and all over the world from all specialties come to learn cosmetic surgery at our surgery center. I also have an online video series for doctors how to do these various cosmetic surgery procedures, including eyelid surgery. And I'm a prolific author. I have two of the top-selling medical textbooks on Amazon right now. The second edition that I'm holding in my left hand of my book, Cosmetic Facial Surgery, and also my newest book, The Art and Science of Facelift Surgery. So I'm passionate about learning, teaching, and operating. As I stated earlier, I really enjoy teaching, and blepharoplasty or cosmetic eyelid surgery is one of our more popular courses, along with facelift surgery. And I really enjoy teaching young doctors. They're very impressionable, very eager to learn how to do safe surgery with predictable outcomes. And I've taught many, many courses in many, many cities, in many, many states and countries and continents, and education has been a part of my core value. So I love blepharoplasty surgery. Like I said, I think it is one of the most straightforward and dramatic procedures that you can do on a patient, but really does take decades to become very good at this procedure.